Good morning, I am Dr. Karan, Department of Medical Gastroenterology, Narayana Medical College. Today we are here for World Hepatitis Day. World Hepatitis Day is recognized annually on July 28th to commemorate the birth anniversary of Dr. Baruch Blumberg. He was the one who discovered the virus and the vaccine for it. In 1976, he was given the Nobel Prize in Physiology or Medicine for his work on hepatitis B. Organizations around the world commemorate World Hepatitis Day to create awareness about viral hepatitis, which affects more than 354 million people in a year. Viral hepatitis include viral hepatitis caused because of hepatitis A, B, C, D and E. Viral hepatitis claims lives of more than 1 million people in a year. While deaths because of tuberculosis and HIV are declining, the deaths due to viral hepatitis are increasing. Coming to the theme of World Hepatitis Day 2021, hepatitis can't wait. With one person dying every 30 seconds due to the viral hepatitis and its complications, even in the present COVID-19 crisis, it is important to create awareness and test for viral hepatitis. Hepatitis A is caused because of a virus, hepatitis A virus, found in the stools and blood of the infected individual. It spreads when someone unknowingly ingests even microscopic quantity of the virus. Hepatitis A is vaccine preventable illness. The symptoms of hepatitis A can be nausea, fatigue, stomach pain and jaundice. The best way of prevention of hepatitis A is by vaccination. Next, the hepatitis B. Hepatitis B is a vaccine preventable illness caused by the hepatitis B virus, which spreads from the infected individual to the uninfected individual via the blood, semen or body fluids. It can also spread from the mother to the child. It spreads usually through the unsafe sexual practices or drug abusers or other drug injecting equipment. Hepatitis B, the symptoms will usually be including nausea, fatigue, abdominal pain, jaundice and decreased appetite. For many individuals, hepatitis B is a short-lasting illness called the acute hepatitis B. For many others, it can also result in a chronic, long-lasting illness leading to cirrhosis or even hepatic cancer. Hepatitis B, the best method of prevention is by vaccination. Next, hepatitis C virus. Hepatitis C is spread from the infected to the uninfected individual by contamination of sharing of needles and other drug injecting equipments. Hepatitis C in more than half of the individuals leads to a chronic infection, ultimately which leads to cirrhosis or liver cancer. There is no vaccine for prevention of hepatitis C, and the symptoms of this disease are usually the signs of advanced liver disease. Hepatitis C has to be recognized early by frequent testing, and with effective treatment, most of the people get cured of hepatitis C. Hepatitis D. Hepatitis D, called as the delta hepatitis, usually occurs in individuals who have been infected with hepatitis B. Hepatitis D occurs as a superinfection with hepatitis B in an already infected individual. And when hepatitis D and hepatitis B occur together, it is called as a co-infection. There is no vaccine for prevention of hepatitis D. However, vaccinating for hepatitis B prevents hepatitis D. Coming to the last, hepatitis E, caused by the hepatitis E virus, which spreads from the infected individual to the uninfected individual when they unknowingly consume the food or water contaminated by the feces of the infected individual. Hepatitis E has to be diagnosed early and usually presents with symptoms of the nausea, fatigue, jaundice, stomach pain, decreased appetite. Hepatitis E has no vaccine in India. Usually people have short-term illness lasting for less than 2 months. But some individuals who have immunocompromised status may develop chronic form of the illness. Here I would like to conclude my talk on World Hepatitis Day by again repeating the theme that hepatitis can't wait. It is very important to detect hepatitis very early, especially when you are considering hepatitis B where more than 90% of the infants infected with hepatitis B go in for the chronic form of the illness, while only 6 to 7% of the adults land up in chronic hepatitis B. Hence, early detection, awareness, and taking the vaccines which are available for hepatitis A and hepatitis B is the goal. Thank you very much.